I woke up one morning and couldn't catch my breath walking to the bathroom. That's when everything changed. I was only 37 years old, and my body was screaming at me in a language I didn't understand yet. Here's what terrifies me about that moment. I had been ignoring warning signs for months. Maybe years. My body was sending me messages, but I kept hitting the snooze button on my health. Today, I'm going to share the early warning signs of heart disease that doctors wish everyone knew. These aren't the dramatic chest-clutching moments you see in movies. They're subtle. They're easy to dismiss. And they could save your life. Let's start with something that sounds completely harmless. Fatigue. Not the kind of tired you feel after a long day at work. This is different. It's a bone-deep exhaustion that doesn't go away with rest. Your heart is a pump, right? When it starts struggling, your body doesn't get enough oxygen-rich blood. Every cell in your body begins running on empty. You feel tired climbing stairs. You need to sit down after simple tasks. You blame it on stress or getting older. But here's the truth that changed my perspective forever. Your body doesn't lie to you. When you're constantly exhausted for no clear reason, something is wrong. This fatigue often appears months or even years before a heart attack. Women especially need to pay attention to this symptom. Studies show that more than 70% of women who have heart attacks reported unusual fatigue in the weeks leading up to the event. That's not a coincidence. That's your body raising a red flag. Now let's talk about something even more surprising. Jaw pain. Yes, you read that right. Pain in your jaw, especially on the left side, can be an early warning sign of heart disease. Why does this happen? The nerves that serve your heart and jaw are connected. When your heart is in distress, the pain signals can get confused. Your brain interprets the message as coming from your jaw instead of your heart. I remember thinking I needed to see a dentist. The pain would come and go, usually when I was stressed or physically active. It never occurred to me that my jaw was trying to tell me about my heart. Here's what makes this particularly dangerous. Most people, including many doctors, don't immediately connect jaw pain with heart problems. They look for dental issues. They check for TMJ disorders. Meanwhile, the real problem continues to worsen. Shortness of breath is another critical warning sign that people often misinterpret. You might notice you can't walk as far as you used to. Climbing stairs leaves you gasping. You wake up at night feeling like you can't get enough air. This happens because your heart isn't pumping efficiently anymore. Fluid starts backing up into your lungs. Your body isn't getting the oxygen it needs. Every breath becomes a little harder, a little more labored. The scary part? This symptom develops so gradually that you might not even notice it at first. You start avoiding stairs. You park closer to store entrances. You tell yourself you're just out of shape. But your body is trying to protect itself from a struggling heart. Research shows that unexplained shortness of breath, especially when lying down, is one of the most reliable early indicators of heart disease. If you need to prop yourself up with pillows to breathe comfortably at night, that's a serious red flag. Swelling in your legs, ankles, or feet might seem completely unrelated to your heart. But it's actually one of the most visible signs that something is wrong. This swelling, called edema, happens when your heart can't pump blood effectively throughout your body. Blood starts pooling in your lower extremities. Fluid leaks out of your blood vessels into surrounding tissues. Your shoes feel tight by the end of the day. You notice indentations on your skin from your socks. You press your finger into your ankle and the dent stays there. This isn't just uncomfortable. It's your circulatory system failing to do its job. Your heart is working overtime, but it can't keep up with the demands. The backup of fluid is a mechanical problem that needs immediate attention. Many people dismiss this swelling as a normal part of aging or standing too long. They don't realize their heart is struggling. By the time they seek help, significant damage may have already occurred. Dizziness and lightheadedness deserve serious attention too. When your heart isn't pumping enough blood to your brain, you feel woozy. The room spins. You need to grab onto something for support. You might even faint. These episodes often happen when you stand up quickly or exert yourself physically. Your heart can't adjust fast enough to meet your body's changing demands. Your blood pressure drops. Your brain doesn't get enough oxygen. You feel like you might pass out. What makes this symptom particularly concerning is how easily it can be dismissed. People blame it on dehydration, low blood sugar, or standing up too fast. They don't consider that their heart might be the culprit. But persistent dizziness, especially when combined with other symptoms on this list, is a clear warning sign. Your cardiovascular system is struggling. Your heart needs help. Your body is literally telling you to slow down and pay attention. Chest discomfort is probably the most well-known heart disease symptom, but it doesn't always feel like you'd expect. Forget the Hollywood heart attack with dramatic chest clutching. Real heart disease often announces itself much more subtly. You might feel pressure, like someone is sitting on your chest. Or squeezing. Or a dull ache that comes and goes. Some people describe it as indigestion or heartburn. The discomfort might radiate to your shoulders, arms, neck, or back. Here's what caught me off guard. The pain doesn't have to be severe to be serious. Mild discomfort that keeps recurring is just as concerning as intense pain. Your heart is struggling, and it's trying to get your attention however it can. Women often experience chest discomfort differently than men. They're more likely to feel it as pressure or tightness rather than pain. They might describe it as uncomfortable rather than painful. This difference in presentation can delay diagnosis and treatment. Irregular heartbeats, or arrhythmias, are another warning sign that demands attention. Your heart might skip a beat. It might race for no apparent reason. You might feel it fluttering in your chest like a trapped bird. These irregular rhythms happen when the electrical signals controlling your heartbeat go haywire. Sometimes it's harmless. But often, especially when combined with other symptoms, it indicates that your heart muscle is damaged or struggling. I used to feel my heart racing at random times. It'd be sitting quietly, and suddenly my heart would pound like it'd just run a marathon. I convinced myself it was anxiety or too much coffee. I was wrong. Atrial fibrillation, one common type of irregular heartbeat, dramatically increases your risk of stroke. Your heart isn't pumping efficiently. Blood can pool and form clots. Those clots can travel to your brain. The consequences can be devastating. Persistent coughing or wheezing that won't go away might seem like a respiratory problem. But it can actually signal heart disease. When your heart isn't pumping effectively, fluid backs up into your lungs. This causes a chronic cough that doesn't respond to typical treatments. You might cough up pink or blood-tinged mucus. You might wheeze when you breathe. You might feel like you have a chest cold that never quite goes away. These aren't lung problems. They're symptoms of a failing heart. This symptom is particularly tricky because it mimics so many other conditions. Doctors might treat you for asthma, bronchitis, or allergies. Meanwhile, your heart continues to struggle. The real problem goes unaddressed. Pay special attention if your cough worsens when you lie down. That's a classic sign that fluid is accumulating in your lungs due to heart failure. It's your body's way of trying to clear the excess fluid that shouldn't be there in the first place. Nausea, indigestion, and stomach pain can also indicate heart problems, especially in women. Your heart and digestive system share nerve pathways. When your heart is in distress, you might feel it in your stomach instead. You might feel nauseous for no apparent reason. You might have persistent indigestion that antacids don't help. You might experience unexplained abdominal pain or discomfort. These symptoms often get dismissed as food poisoning or stomach bugs. But here's the critical detail. If these digestive symptoms occur along with other warning signs like fatigue or shortness of breath, you need to think about your heart. Your body is connecting dots that might not seem obvious at first. Many women who have heart attacks report experiencing flu-like symptoms in the days or weeks before. They feel nauseous. They have no appetite. They feel generally unwell. They never suspect their heart until it's too late. Sudden or excessive sweating, especially cold sweats, can indicate that your heart is working too hard. When your cardiovascular system is struggling, your body goes into stress mode. You start sweating even when you're not hot or exercising. This isn't normal perspiration. It's clammy, cold sweat that appears for no clear reason. You might wake up drenched in the middle of the night. You might break out in a cold sweat while sitting quietly. Your body is in distress. This symptom often accompanies other warning signs. You might feel sweaty and nauseous, or sweaty and short of breath. Your body is mounting a stress response to your struggling heart. It's preparing for fight or flight because it senses danger. Women are particularly likely to experience this symptom before a heart attack. If you're breaking out in unexplained cold sweats, especially at night or during rest, take it seriously. Your autonomic nervous system is responding to cardiovascular stress. Now here's what you need to understand about all these symptoms. They rarely appear in isolation. Heart disease typically announces itself through a combination of warning signs. You might feel tired and short of breath, or dizzy with chest discomfort, or nauseous with irregular heartbeats. The pattern matters more than any single symptom. Your body is trying to tell you a story. It's up to you to listen and connect the dots. Don't dismiss symptoms just because they seem minor or unrelated. Time is critical when it comes to heart disease. The earlier you catch it, the more treatment options you have. The better your chances of preventing serious damage. The longer you can live a healthy, active life. If you're experiencing any combination of these symptoms, see a doctor immediately. Don't wait. Don't convince yourself it's nothing. Don't be embarrassed about potentially overreacting. Your life is worth more than avoiding a potentially unnecessary doctor's visit. Get your blood pressure checked regularly. Know your cholesterol numbers. Understand your family history of heart disease. These aren't just numbers on a chart. They're vital information about your cardiovascular health. Make lifestyle changes that support your heart. Eat more vegetables and whole grains. Reduce your sodium intake. Exercise regularly, even if it's just walking. Manage your stress. Get enough sleep. These aren't optional suggestions. They're essential practices for heart health. Stop smoking if you smoke. Even secondhand smoke damages your cardiovascular system. Every cigarette you don't smoke is a gift to your heart. Every day without tobacco is progress toward better health. Limit alcohol consumption. Excessive drinking raises blood pressure and contributes to heart disease. Moderate drinking might have some benefits, but heavy drinking is always harmful. Your heart deserves better. Manage chronic conditions like diabetes and high blood pressure. These diseases accelerate heart disease if left uncontrolled. Take your medications as prescribed. Monitor your numbers. Work with your doctor to optimize your treatment. Your body truly is a temple. It's the only one you get. When it sends you warning signs, listen. When it asks for help, respond. When it needs care, provide it. You deserve to live a long, healthy life. Your heart deserves your attention and respect. Don't wait until it's too late to start caring for the most important muscle in your body.